The new document outlines goals of the Cypress Health Region and will help guide healthcare moving into the year 2013. The region looked to the province, staff, and other health organizations to tailor the document, but as Beth Vachon, interim CEO for the region, explains, they also asked the people who access their services.
The majority of where this came from was from the patient first review. So based on what the province heard from patients in this province, this is probably, from a patient input perspective, one of the better strategic plans, I think, because of that.
The Cypress Health Region will examine their goals to see how they are measuring up in areas such as health of a patient and staff members. An example of how they will do this is by asking patients to rate their hospital experience and by evaluating staff members' work-life experience.
We have developed a scorecard. It's called a balanced scorecard to make sure that we're actually looking at a number of different areas as we measure the success of our organization. So what we will be doing is having quarterly reports on how we're doing to meet all of those targets and goals.
Standards for the evaluations this year were set at provincial minimums. Vachon explains why the health region decided to use a bare-bone measurement.
We've had the ability to have some input and discussions with the ministry about what are appropriate, targets that we need to be achieving in this first year as a province. 100%, we weren't sure if we could get there. The target is still, I think, at about 50%, which is fairly significant if we can implement that. The expectation, however, in this 3 years will be we will hit 100% by the end of those 3 years. So when we talk about them being big measures and stretch goals, we have a lot of work to do to implement these.
The stretch goals discussed by the Health Board are targets that are difficult for the region because they require a lot of adjusting to achieve them. Vachon used the example of fall prevention as an initiative that they will need to be diligent about implementing at all facilities and bringing up to a higher standard of care. For Southwest TV News, I'm Kara Rapke.